September is Suicide Prevention Month, a time to raise awareness of an often stigmatized topic. Dr. Damian Thomas is the president and clinical director with Resilience Counseling and Recovery Center, and he joins us now to talk about this. Dr. Thomas, thank you for being with us. Tell us how prevalent suicide is among adults.
Yes, thank you for having me on. So, according to the CDC, suicide falls between the second and fifth leading cause of death between individuals ages 25 and 44. Now, along with that, we know that suicides are nearly double the amount with 48,000 in 2021 as compared to 26,000 of homicides. So it's a pretty significant issue, and that's why we're here to address them and try to make sure that we can figure out ways to rectify it.
Obviously, this is something that we'd all like to prevent, but what are some of the things to look out for? What are some of the warning signs of someone who is contemplating or who might be contemplating suicide?
Yes, so when we see individuals in particular giving away valued possessions, that's one of the ones we consider the most obvious. Expressing ideas of wanting to die. If there are any social media messages that suggest as such, any cryptic messages that seem to be out of the ordinary for your loved one, any mood changes, and one of the ones that we also consider is individuals engaging in risk-taking behaviors. For example, like driving a car, 100 miles an hour or more. Things like that are just a few of the ones we want to consider for sure.
So what are some of the things you can do to help mitigate the risk?
Well, number one, remember those signs that we just discussed. Reaching out to the person. Sometimes people may think that if I ask someone about suicide or if they're having any of those thoughts that we may induce some type of behavior, but that's not the case at all. Like, we know that we can ask and that it's okay to ask. So make sure that we do that. Also call or text the suicide crisis line, 988. That number allows you to either, again, call or text and to be able to receive resources and support.
So how do you tell the difference between being, feeling kind of down or just having the blues and actually being suicidal? When does it cross that line?
Yeah, so when we think about the differences between the two, yes, we all have the blues every once in a while. Now we start to look at sleep changes, mood changes, changes in our appetite in terms of our functioning. If it's going more than 3 or more days, now there are causes for concern. So we want to look at that. And if there's anything else out of the ordinary that that does not seem to be the normal pattern of your loved one, you want to consider that also.
Dr. Damian Thomas, Resilience Counseling and Recovery Center, speaking with us during Suicide Prevention Month, the month of September. Thank you for your time.
Thank you for having me on.